You're listening to Navigating Elder Care, where you'll find guidance and answers for every step of the elder care journey. Each week, elder care advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Elder Care. For years, I have been helping families and medical providers, doctors, social workers, case managers, nurses find the right solutions for seniors in transition, whether that's after a hospital stay, a rehabilitation stay, or when care needs at home have changed. We assist in finding the right care options. I started this work because I saw how overwhelming and confusing the elder care process can be, and I wanted to be a guide and a resource for both families and professionals. Each week on Navigating Elder Care, we tackle the real questions and challenges that families and providers face during care transitions. I have spent over 30 years working as a registered nurse, specializing in geriatric care. I have dedicated my career to advocacy and care transition planning. This podcast brings together my experience and passion to support you on your care journey. In my business and in my work at Care Advocates, we walk alongside families every step of the way. We meet families, clients, and providers to create a customized care plan. When someone is needing additional care and support, assistance with their care needs, transfers, bathing, dressing, after someone has had a stroke or they're in the hospital and they're about to leave home, we assist them in finding the right care options. That could be an assisted living community, a memory care community, a residential care home, or just bringing trusted resources into the home to support that client and family. We assist with all of those care options. Most importantly, we provide ongoing solutions and support. The care journey should never feel overwhelming. It should feel guided, supported, and understood. In today's podcast, we are going to talk about the different types of senior living options that are out there for yourself or for a loved one that may need care. When it comes to aging, the need for assistance can be significant. According to the U.S. Department of Health and Human Services, over 70% of those who turn 65 are going to need some type of care, some type of assistance. This means assistance with bathing, with transfers, with ambulation. Additional data reinforces this trend. Over half of adults will develop some serious diagnosis or disability after the age of 65 that is going to require paid long-term assistance. In short, the majority of seniors will require assistance as they age, highlighting why it's so important for you to become educated and know what the senior living options are in case you or your loved one will ever need assistance. And also understanding all of the resources, both paid resources and Medicare-covered resources that you are eligible for. Finding the right care can feel complex. It is not just about choosing a place. It is about making sure that every aspect of your loved one's life is supported. You need to consider many things: care needs, social needs, financial resources, safety and environment, family well-being. How will this choice support both you and your loved one's independence and your family's peace of mind? Choosing care is about finding the right balance, a setting that supports dignity, safety, and independence while still offering flexibility that will adjust to your loved one's needs, care needs, as it evolves. So when we talk about senior living options, let's talk about the basics. Senior living options encompass a range of choices that are designed to support older adults as they age, and they have different care needs. These include 55 plus communities, independent living communities, assisted living communities, memory care settings, and skilled nursing. We all know that staying physically, socially, and mentally active is important at every age, but even more so as we get older. Studies show that an active lifestyle and a strong social connections help us keep happier and healthier as we age. 55 plus communities really offer that. They foster a true sense of social connections. They're designed for active adults, for active older adults. These are apartments. Some are very basic, small, and some are luxury apartments. They have full kitchens. Residents who live there are responsible for all of their utilities, their water, their cable bill. This is maintenance-free living with optional concierge services. They focus on social connections with a full calendar of activities, classes, and events. A lot of great programming to support active aging, fitness classes, continuing education classes, enrichment activities, and social gatherings. Pets are allowed in these communities. One example I can think of a client that I helped move into a 55-plus community is a lady by the name of Margo. She was 75 at the time, a very young 75-year-old, and her husband had passed 4 years prior to that. And she grew very isolated. She lived in a very nice neighborhood in a very big home, and she just became isolated, had very little friends, probably had a little bit of depression and anxiety, and she wanted to downsize. So we started talking about the different senior living options, and a 55-plus community was perfect for her. So we went and looked at a couple. She moved into one, and she's been there for a couple of years. She's very happy there. She loves to bake, and now she's hosting her own weekly baking class at this 55-plus community. She's even dating. So it's been very good for her. This is what these 55-plus communities offer. They offer older adults the social connections that many times they miss out if they are just after someone passes or if they are home alone. You really become isolated. So having the ability to be in a setting like this gives you many options. You can be as private as you want to be, or you can be very involved in a lot of the social programming that these apartments offer. The next option that we're going to talk about is independent living. These communities are more comprehensive. They're maintenance-free, and all of the services are bundled in, all of the amenities. For example, your meals, your dining, housekeeping, all of your utilities are bundled in. The focus here is for active seniors who can manage their daily lives but desire a low-maintenance lifestyle. Services include meal plans, housekeeping, laundry, scheduled transportation, a lot of very busy programming and calendars that include wellness, fitness activities, a lot of arts and crafts come in, a lot of music, happy hour. Care is not included in independent living. However, you have the option if you need care. For example, if you are hospitalized and after the hospital, you come back into your independent living community and you need a caregiver for a few hours a day. Many of these independent living communities have on-site care staff that you can pay hourly to assist you, or you can bring your own caregiver as well. These communities allow you to stay active with yoga, Zumba classes, water aerobics, or you can just simply relax indoors and keep as quiet as you want to be or stay very busy. These are very stylish apartments. Some are very basic and some are 3-bedroom apartments. You're going to find convenience in these. And also they offer you that social connection, that sense of fellowship, sense of community, all in one place. Pets are allowed in most of them. And remember, you also get the housekeeping and the laundry services included. One example that I will never forget that I moved into an independent living community, I assisted her with independent living options, was Betsy. And Betsy was referred to me by an elder care attorney. When I visited Betsy in her apartment, her husband had passed a few years prior, and very small apartment, and it was evident that she needed assistance with meals. Her food was frozen dinners in the microwave, and she was very isolated. The only time she would get out was to go to her community church, maybe once a week or every other week. And Betsy was open to the idea of independent living. She had no idea what these places would look like. She thought it was very much a nursing home-like setting. So I picked Betsy up one morning and we went to go look at 3 independent living communities. When Betsy walked into the first one, it was very obvious that she was very pleasantly surprised. We met the sales director there. We got to see all of the amenities, the movie theater, the beauty salon, their mail room, courtyards, the dining room. And Betsy's comments were, is all this for me? Do I get to use all of this? And absolutely, right? So anytime you're in an independent living community, all of the amenities are yours, from the courtyard to the movie theater, the pool, the dining room, the library. Everything is for you to use. And she was very surprised, and she glanced at the piano and stared at it and didn't say much. Very quiet lady, very shy, very introverted. So we go into the second independent living community. She walks in and she stares at the piano again. We looked at that. We got to see all the amenities at the second option. We go to the third option, and there was a big piano in the entrance, and she stared again. The sales director asked her if she played, and Betsy very quietly said, I used to play. So sales director invited her to sit and play the piano. And there was only one other person in the little living area. As Betsy started playing, all of these residents started to come out of their rooms and out of the dining room to listen to her play. And you could see her very quiet, shy demeanor just blossom. All of a sudden, she started to sit up straight, and you could see a smile in her face. She started to play the piano, and there were about 20 to 25 people that were listening to her play. She played a couple of songs. She got a standing ovation, and you can just see everything about her changed. She picked one of the independent living communities, moved in, and she has been there ever since. Very happy, thriving. She has a sense of purpose. She plays the piano, and she has friends, and she never had that before when she was so isolated in that apartment. The next type of setting we're going to talk about is assisted living, and this is for someone that is requiring care, activities of daily living, as we call them, ADLs. When someone is needing care, we look at assisted living options, and these include personal care assistance with bathing, dressing, grooming, toileting, transfers. Medication management is offered and is given. Meal services, all of the meals are included. Breakfast, lunch, dinner, snacks. Transportations to appointments is often included, to shopping centers such as, your local Target, local grocery store, some fun outings to museums. Now, when we talk about pricing with all of these options, there's such variances. So for pricing, you can call me, reach out to me, and I can give you more details. But with assisted living, you have the room price. You have the room plus your amenities, all of your cable, utilities, everything is included, housekeeping, room. That's one price. The second price that you see is what we call the level of care, and that is determined by a nurse in the community. They will go out and assess yourself or your loved one, and depending on what your care needs are, right, from simple standby assistance with showers to full care, transfers, bathing, dressing, toileting, that is going to determine what the level of care cost will be. The nurse will she will create a care plan for you. She'll sit down with you and find out what you like, don't like, exactly when the care is needed. And that plan of care determines the price and determines the care that you are going to receive at an assisted living community. Key features in assisted living communities include, of course, your room, and this can be a small studio to a 2-3 bedroom. They offer a balance of independence living that is supported with care. Residents live in their own apartments and often have private bathrooms. Some of them have small little kitchenettes. You have on-site staff available 24 hours a day, 7 days a week that provide supervision, security, and assistance with emergencies and with your care needs. They also offer social engagement. Assisted living communities offer a range of social and recreational activities, which really helps so that you are not so isolated. They promote a resident's well-being. Also note that you can be as busy as you want to be. They're very busy with calendars and social programming, but you can also stay in your room and just have quiet time. They also offer a lot of common spaces, and like those I mentioned at independent living, they offer common areas such as dining rooms, libraries, game rooms for socialization and group activities. Also a lot of social outings. An example of a client that I moved into an assisted living recently, Her name is Margaret. Margaret was living alone independently in her apartment, and she fell and fractured her hip. We moved her in about a month and a half ago. She's continuing with her physical therapy and occupational therapy in her new assisted living community, but now she receives the care that she needs. She's able to walk with a walker. She's needing assistance with bathing. She can dress herself, but the care is there if she needs it 24 hours a day, and she's doing great. She's continuing to be social with all the activities that she likes, and she's joined a couple of groups. But the important thing for Margaret now and for her daughter is that she is safe and she's being supervised with the care that she needs when she needs it. The next example of care that we are going to talk about is memory care. The next care option that we're going to talk about is memory care communities. Memory care communities are a specialized form of long-term care for those residents that have a diagnosis of dementia, Alzheimer's, or any cognitive memory care issues. They offer a secure environment, structured routines, and tailored activities to ensure safety, engagement, and dignity while providing families with support and peace of mind. Memory care communities are secured. They are specialized in dementia care with structured routines and trained staff. Memory care is a very specialized type of community that provides 24-hour supervision with tailored activities and safety features for individuals with any dementia diagnosis or any form of cognitive decline. Unlike a traditional assisted living community, memory care facilities offer a secure setting with specialized trained staff to manage cognitive impairment. They use strategies like music therapy, structured routines to keep residents engaged, safe, and stimulated. They have very personalized care plans. Each resident receives a care plan tailored to their specific needs, abilities, and preferences, which is regularly updated to adapt to their changes in care and condition. Of course, they offer 24-hour support. Residents receive constant care and supervision to ensure safety and well-being throughout the day and night. You are going to find that memory care communities have a higher staffing ratio than your assisted living communities. So who is memory care for? Who would be a good fit for a memory care community? Any individual with a diagnosis of dementia or cognitive decline that requires more intensive support and just more supervision. It's a designed environment to manage their symptoms safely and effectively. You are going to find that these rooms are smaller. They're strategically smaller to avoid overstimulating residents. Anyone experiencing confusion, mood changes, or just difficulty in their day-to-day tasks would be a good resident for memory care. Anyone that is wandering or at risk for falls. One example that comes to mind is someone that I placed recently, a very young 66-year-old resident, Diana. She lived with her husband, and Diana was wandering around the house at risk for falls. She had suffered multiple falls. She was just very confused as to where the bathroom was. She would also exit seek, and if the door was left open, she would walk out into her front yard. Just needing assistance with many things, but it was becoming a safety concern for her husband. She was also up at night, walking into the kitchen, opening up the refrigerator, and it was becoming overwhelming for her spouse. He did have care at home, and caregivers were coming in to support her a few hours a day, but he was finding that more care was needed. The cost of that was becoming more than what a memory care community would cost. So we toured a couple of communities, moved her into a 16-bed memory care, and she's doing great. And the husband is now able to just be to be the husband and not be the caregiver, the cook, and everything else that goes with taking care of someone, which is very taxing. So he visits her daily, and he's just there to be her husband and love her without having the responsibility of the 24/7 care that he was providing, because he was up at night with her most nights. The second type of care that we are going to talk about are residential care homes. These are very different, very small. Some are 6-bed. It provides a very home-like environment with higher staffing ratios. This is for someone that needs more care. Rates are usually flat rates. These are great options for families that are looking for a higher level of care for their loved ones. They tend to be a less expensive option at times. Pets are not allowed. These are great options for those that want a very home-like environment. And we have many wonderful care homes in San Antonio. It's for somebody that may not be very social, that is very quiet, and that is needing more care. This could be a great option. And some families love what a small residential home offers, which is a very home-like feel, very much like the home that they're living in. The last care option that we are going to talk about is staying at home, which is called age in place. And everybody always wants to stay home and age in their own home. And this can be done. As your care needs increase, you can do that safely while still staying home by bringing in care support as you need it, in-home care. And as the care needs increase, you may want to hire a caregiver to stay home and support you with services such as bathing, dressing, meal preparation. And we do partner up with great providers who can assist with the day-to-day needs that you may need as you stay home and start needing more care. We can also connect you with supportive services at home, which can include home health, physical therapy, occupational therapy, nursing. These are Medicare-covered resources that can come into your home and support you as you are needing more care. We can also connect you with visiting physicians groups, visiting doctors, house call doctors that can come in and assess. They can see you monthly and as needed in your own home, podiatry, x-rays, labs. There are so many Medicare-covered resources that can come into the home and support you as you are aging and needing more care. Also connecting you with maybe an age-in-place specialist that can come in, assess the home for safety modifications, key adoptions that can allow you to age at home safely. Some can be simple home modifications, maybe assessing pathways for secure flooring, stair safety, lighting, looking at just things like proper lighting, potential hazards items that may become hazardous, log cabinets, just easy to use fixtures, consistent layouts throughout the home, maybe labeling drawers, having clear signs of different things in the home. These are all designed to allow you to age at home safely. When the care needs at home become so much that perhaps you're starting to need more hours of a caregiver or it becomes unsafe for you to stay home, then that's when we start looking at other options like I've mentioned, whether it's assisted living, a residential care home, or a memory care community. You need to start planning for next steps. And for you to begin that, it's important that you visit with your primary care doctor and start discussing what the care needs are. Maybe seeing a specialist. You may want to consider a gerontologist rather than a general practitioner. A geriatric doctor specializes in older adults and understands that seniors often present symptoms differently. For example, urinary tract infection in an older adult may look more like sudden confusion or cognitive decline than the actual physical discomfort. These specialists are trained to manage complex medical conditions in aging adults very differently than a general practitioner would. So as you start thinking about what the next steps are going to be as your loved one ages and needs more care, connecting with a gerontologist, a doctor that specializes in older adults, is very important. Also, start exploring assisted living options or resources that can come into the home. 90% of the clients that we assist in placement, over 90% happen in an emergency situation, meaning that someone fell, had a fracture, and they're calling us to find care. What are the care options? We need to tour assisted living communities. So looking at options early and touring early helps you feel confident and prepared instead of being rushed and doing it at the last minute. Remember, assisted living often provides greater safety, dignity, and quality of life while offering peace of mind to families. It's great to be prepared instead of waiting for an accident to happen and knowing what all of the options are for you, not only options for your loved one to possibly live outside the home, but what are the options in the home? And you can give me a call. We can provide you with all of those resources as you are needing them. Thank you for joining me today on Navigating Elder Care, where we bring guidance and answers for every step of the elder care journey. If you are a family member, hospital case manager, healthcare provider, and you know of someone facing a change in health or planning for future care needs, Care Advocates is here to help you find the right care at the right time. Whether it's assisted living, memory care, or bringing trusted community resources into the home, we walk alongside you every step of the way. If you know someone who had a stroke or is needing more care, we meet our clients personally. We create a customized care plan. We discuss care options that fit their needs based on budget, location, care needs, unique situation. We provide ongoing solutions and support. Our commitment is simple: care, compassion, lifetime support. For a free consultation, give me a call at 210-669-2222. You can listen to us every Sunday morning at 8:30, right here on 9:30 a.m. The Answer. You can also listen to us on your favorite podcast application and visit us at advocatern.com for helpful resources. If you have a question or an idea for a future episode, email me at Laura, Laura, advocate, advocatern.com. I am Laura Daniels, and this is Navigating Elder Care, helping you find the right care at the right time for people that matter the most.
This has been Navigating Elder Care with Laura Daniels, providing guidance and answers for every step of the elder care journey. For a free consultation, call 210-669-2222 or email Laura at advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com.